So did you know here in Oklahoma and really across the United States, Indigenous women have the highest rates of death and health complications during and following pregnancy? But a new grant coming here to our state aims to change that. Here with me today, we've got Dr. Emily Jones with the OU College of Nursing and Dr. Cassandra Quarterbitty with the Southern Plains Tribal Health Board. Welcome in, ladies. Great to see you. Thanks so much for being here.
Thanks for having us.
Important stuff, that's for sure. So let's talk about the fact that here in Oklahoma, and like I said, across the U.S., this is a real problem. We have some of the highest rates of death and complications for Indigenous women. Why is this happening?
Yeah, that's a great question. And I think there's more attention being paid right now to the root causes of poor maternal health in this country. What we know is that the causes are certainly social and structural, as well as biologic in terms of disease processes. We know that often in this country, and certainly also among Indigenous populations, women and young women do not enter pregnancy as healthy individuals. And so the conditions of pregnancy are very stressful and create an environment where someone who wasn't in optimal health can actually become very unhealthy during that time period. But that has dire consequences for mother and baby.
Course. Dr. Quarterbitty, anything to add as to why you think that this could be occurring?
Actually, I think Dr. Jones hit all those in terms of structural, systematic things that are creating these barriers for women to become as healthy as possible before becoming pregnant.
And, you know, the thing I was reading as I was doing some research for this interview here is that 90% of these could really be preventable. Right. How could we be preventing this?
Yeah, Shelby, this is something that in the United States is getting just a spotlight shown on it right now, because to think that 90% of deaths among Indigenous women could be preventable makes us stop and say, why, how? And part of it is the training of providers to be very aware of danger signs, and also the education of patients and individuals and families to know the warnings, the red flags to be looking for, not only during pregnancy, but in the days and weeks and months thereafter.
I think that's important to note, right? It doesn't just stop once baby is born. Definitely continues on past that. So let's talk about this grant here. $10.5 million is coming in partnership with both of your organizations here. Tell me how this study is going to work, what you guys are going to be looking at, how that money will be used.
Yeah, it's exciting. It's more than just one research study, Shelby. So this is a research center of excellence, which is funded by the National Institutes of Health. The National Institutes of Health have funded 10 of these nationwide. So we are very excited that our organizations and our partnership was selected to be one of the 10. And we are one of 3 in the U.S. that focus on Indigenous health. And so apart from the research projects that will be made possible through these monies, we also have the capacity now and the ability to usher in new training programs and community partnerships. And some of these tribal community and academic partnerships have been long-standing, and there will be some new ones to come as well. And the idea is that this $10.5 million will allow us to do more than we've ever done to focus on Indigenous maternal health in the state.
I think it's important that we talk about the partnership, as you said. This is really a joint venture. So Dr. Quarterbitty, I don't know if there's anything you want to add here in terms of how important grant money like this will be to helping our moms out there and our Indigenous populations.
Yeah, that's a good question. I think these partnerships could do a lot for the communities. Southern Plains Tribal Health Board, we serve the tribes in Oklahoma, Kansas, and Texas. And so this grant funding is going to focus on the 39 federally recognized tribes in Oklahoma. So we have the second largest populations of Indigenous, American Indian, Native American women, and it puts a lot of those dollars back into the research, and it gives a voice to these communities that often go overlooked and are sometimes invisible twice when we look at data. There's not a whole lot of data points for American Indians, so even getting those grants for those tribes, getting those grants for themselves, it's very difficult because they don't even have the data to support the need. And so this is going to be a great thing that's just going to really trickle down and allow the tribal nations to really just really go into their sovereignty and being able to take better care of their families, their communities, and their tribal citizens.
It's a great answer there. And just want to reiterate, one of 3 programs, partnerships in the whole country, right? That was awarded this in
Yes,
this
so
way. So
there
it's
were
really,
10
Yeah.
and 3 for Indigenous.
3 for Indigenous. I mean, just unbelievable work being done here in our state, and it's all to better the health of our moms and specifically our Indigenous moms. So thank you guys so much for coming on today. We really appreciate it, and we appreciate all your work that you do for Oklahomans.